Mpox is a disease caused by the Mpox virus. This virus is a member of the Orthopoxvirus genus, which includes other notable viruses such as cowpox and smallpox. The Mpox virus is known for its distinctive appearance under the microscope, resembling a brick-shaped structure with a complex outer layer. This virus belongs to the same family as the smallpox virus, known as the Poxviridae family. While both viruses share similarities in their genetic makeup and structure, they differ significantly in their impact on human health. However, Mpox is generally less severe than smallpox. Smallpox had a high mortality rate and was responsible for millions of deaths before its eradication. In contrast, Mpox tends to cause less severe symptoms and has a lower fatality rate, though it can still be serious, especially in vulnerable populations. The first human case of Mpox was recorded in 1970 in the Democratic Republic of Congo. This initial case marked the beginning of our understanding of the disease and its potential impact on human health. Since then, outbreaks have been reported in several Central and West African countries. These regions have seen periodic outbreaks, often linked to contact with infected animals or through human-to-human transmission. Mpox can cause a range of symptoms from mild to severe. Common symptoms include fever, headache, muscle aches, and a characteristic rash that can spread across the body. The rash often progresses through several stages, starting as flat lesions and eventually forming scabs. The disease can be particularly dangerous for young children, pregnant women, and people with weakened immune systems. These groups are at higher risk of developing severe complications, which can include secondary infections, respiratory distress, and in some cases, death. Understanding Mpox is crucial for effective prevention and control. Researchers are continually studying the virus to develop better diagnostic tools, treatments, and vaccines. Public health initiatives focus on educating communities about the risks and prevention strategies. In recent years, Mpox outbreaks have been reported in countries outside of Africa. These outbreaks have been linked to international travel and the global movement of goods and people, highlighting the interconnected nature of our world. This has raised global concerns about the potential for wider spread. International health organizations are working together to monitor and respond to these outbreaks, aiming to prevent a global health crisis. Therefore, it is essential to stay informed about Mpox, its symptoms, and how it spreads. By understanding the disease and taking appropriate precautions, we can help protect ourselves and our communities from this viral threat. Mpox typically begins with flu-like symptoms. These include fever, which can be quite high and persistent. Accompanying the fever, individuals often experience severe headaches, muscle aches, and a general sense of fatigue. This overwhelming tiredness can make even simple tasks feel exhausting. Swollen lymph nodes are another distinctive feature of Mpox. These can be tender and painful, often appearing in the neck, armpits, or groin. After a few days, a rash appears. This rash is a hallmark of Mpox and is crucial for diagnosis. The rash often starts on the face and then spreads to other parts of the body, including the trunk, arms, and legs. This includes the palms of the hands and soles of the feet, areas that are not commonly affected by other rashes. The rash progresses through distinct stages, each with its own characteristics. It starts as flat, red lesions, which can be itchy and uncomfortable. These lesions then develop into raised bumps filled with clear fluid, resembling small blisters. These bumps later become pustules, which are filled with pus. The pustules can be painful and may eventually scab over and heal, leaving scars in some cases. The Mpox rash evolves over several weeks. The pustules eventually scab over and fall off. This leaves behind marks on the skin, which may fade over time. The duration of the rash varies from person to person. However, it generally lasts for 2 to 4 weeks. Throughout the rash's progression, individuals with Mpox are highly contagious. It is crucial to isolate oneself during this period to prevent further spread. Diagnosing Mpox involves a combination of clinical examination and laboratory testing. Doctors will assess the patient's symptoms, including the characteristic rash. Laboratory tests are essential to confirm the diagnosis. These tests involve taking a sample from a lesion and examining it for the Mpox virus. Molecular testing, such as polymerase chain reaction, PCR, is the most accurate method for detecting the Mpox virus. Early diagnosis is vital to initiate appropriate treatment and prevent the spread of the virus. Section 5. Deciphering the transmission of Mpox. Understanding how Mpox spreads is crucial for preventing outbreaks and protecting public health. Mpox can spread through various routes, primarily through direct contact with an infected person or animal. This means that touching the skin, bodily fluids, or lesions of someone who is infected can lead to transmission. Contact with contaminated materials, such as bedding or clothing, can also transmit the virus. These materials can harbor the virus for extended periods, making it easy for someone to get infected if they come into contact with them. Respiratory droplets released when an infected person coughs or sneezes can spread Mpox. Although this mode of transmission is less common, it can still occur, especially in crowded or poorly ventilated spaces. However, this mode of transmission is less common compared to direct contact. It's important to note that while respiratory transmission is possible, it requires prolonged face-to-face interaction. Animal-to-human transmission can occur through bites or scratches from infected animals. This is particularly a concern for those who handle wild animals or work in environments where they are present. Rodents are considered potential reservoirs of the Mpox virus. They can carry the virus without showing symptoms, making them a hidden threat in the transmission chain. Scientists are actively studying these animals to better understand their role in spreading Mpox and to develop strategies to mitigate this risk. Section 6. Mitigating the spread prevention and control measures. Preventing the spread of Mpox requires a multifaceted approach. This includes implementing hygiene measures, adopting protective practices, and considering vaccination. Hygiene plays a crucial role in breaking the chain of transmission. Regular hand washing with soap and water is paramount. If soap and water are unavailable, alcohol-based hand sanitizers can be used. It's important to cover one's mouth and nose when coughing or sneezing to minimize droplet spread. Section 7. The role of hygiene in Mpox prevention. Maintaining personal hygiene is essential for preventing Mpox transmission. This includes avoiding touching one's face, especially the eyes, nose, and mouth, with unwashed hands. Properly cleaning and disinfecting surfaces that may have come into contact with the virus is crucial. This includes bedding, clothing, and other personal items. It's also important to avoid sharing personal items with others, particularly if someone is suspected or confirmed to have Mpox. Section 8. Protective measures. Reducing the risk of Mpox transmission. Protective measures can significantly reduce the risk of Mpox transmission. Wearing gloves and a mask when in close contact with an infected person is essential. Avoiding contact with infected animals is also crucial. This includes refraining from handling dead animals, especially rodents. If contact with an infected animal is unavoidable, it's important to wash hands thoroughly with soap and water immediately afterward. Section 9. Vaccination, a shield against Mpox. Vaccination is a valuable tool in preventing Mpox. Smallpox vaccines have been shown to provide cross-protection against Mpox. Vaccination is particularly recommended for healthcare workers, laboratory personnel, and individuals at high risk of exposure. Vaccinations can significantly reduce the severity of Mpox symptoms, even if infection occurs. It's important to consult with a healthcare provider to determine the need for vaccination. Section 10. The importance of early detection and treatment. Early detection and treatment are crucial for managing Mpox effectively. Individuals experiencing Mpox symptoms should seek immediate medical attention. Prompt diagnosis allows for appropriate care and isolation measures to be implemented, preventing further spread. Treatment for Mpox typically involves managing symptoms and providing supportive care. Antiviral medications may be prescribed in severe cases. Section 11. Conclusion. Empowering ourselves against Mpox. Understanding Mpox, its symptoms, transmission routes, and prevention measures is crucial for safeguarding public health. By following hygiene practices, adopting protective measures, and considering vaccination, we can effectively mitigate the spread of this virus. Early detection and treatment are essential for managing Mpox effectively and minimizing its impact. Together, through knowledge and proactive measures, we can empower ourselves and our communities to combat the threat of Mpox. Remember, prevention is always better than cure.